Okay, this video is how come internists never invite me to lecture, okay? And this goes back for over a decade, okay? I know lots of internal medicine doctors and subspecialty doctors, especially internal medicine subspecialties like cardiology, endocrine, PMR, physical medicine and rehab. And the radiologists and neurologists, the neurologists like me to give them lectures, teach them about CT and MRI of the brain, for example, and the pathophysiology, and they're real curious and enthusiastic about that. Whereas I've noticed with internal medicine and the related subspecialties, they'll come to me for their individual personal health. I got a lot of internists that'll come to me on how to manage their lipids, for example. They'll come to me for related subspecialties. The related subspecialties like cardiologists will ask me questions, the PMR. Again, a lot of them, doctors come to me to help me take care of their own personal self and their families. But here's where it'll start to get a little interesting. They'll give me a lot of compliments about, my understanding of diet, coronary artery disease, atherosclerosis, hypertension, diabetes, GERD, dementia. And they'll say, oh, your book's so funny, all this type of stuff. They're very nice about it. And I like seeing them. They're my friends. But here's where things get a little weird. They'll often say to me, we really should have you give a lecture to the fellows or the residents. And I'll say, sure, anytime. Then they smile. Then this has happened so many times, I can predict this is going to happen. They get a little nervous look on their face. Then there's like an awkward silence. And then they go, yeah, well, I'll see you later. And they never follow up to invite me. And I know why. Here's why. They're busy. They're seeing about 20, 30 patients a day. They have to talk to the patient, do a brief history and physical, check the labs, make a treatment plan. They'll often write a prescription or send the patient for another consult. If they had to add to that by talking with the patient about diet or toxicology and all this stuff, lifestyle and habits, that would add like 10 minutes or more to each visit. They would not be able to see as many patients. They'd be going home later. They would not get paid for it. Their revenues would probably go down. This is the same way for every single doctor and every single hospital or clinic in the whole United States. That there's no financial incentive to talking to patients about this stuff. You don't get paid for it. Also, if a patient has a bad outcome and you've deviated from the standard guidelines, you could be liable for that. You're expected to practice the standard of care. So that it protects the doctors from med malparal. Okay, that's why I've had doctors say to me, how come their physicians prescribing them calcium supplements when calcium supplements are bogus, and their doctors just doing it because it's a habit from guidelines and they haven't kept up with the reading that calcium supplements are totally overrated. Okay, so that's why medicine really can't improve. The patients are sicker than ever. They're dying of the same diseases they did 30 years ago. They're even worse now. Okay, so it really has not progressed. Hypertension, diabetes, coronary artery disease, all this stuff is the same as it was over 30 years ago. And no one ever lists the results. Like if you had a great athlete, that great athlete runs the fastest or whatever it is for their sport. If you had doctors categorize, okay, this is so-and-so's outcomes, his wins and losses with diabetes, enabling them to reverse their disease, coronary artery disease, etc. What that would do is it would then show that the low-fat vegan diet had the best results. And then drug sales will go down. So the drug companies don't want that. The hospitals right now are making a lot of money selling drugs, so they don't want that. Nobody wants it, but that's the best thing that works. So that's why I'm trying to say is medicine's stuck in this steady state Nash equilibrium where it can't improve itself. And that's why too you say to yourself, well, why isn't a doctor like me out teaching other doctors? And the reason is it can't work in the current system unless it's rewarded by reimbursement or at least not punished. And right now it's currently punished, this stuff, in standard clinical practice. And so that's why it doesn't happen. Anyways, it's a little bit interesting.